Welcome to another episode of Before You Kill Yourself with your host, Leo Flowers. Today's episode is brought to us by BetterHelp, H-E-L-P. Help! I need somebody, help! Always somebody. Is there... I had way too much fun with that. Is there something interfering with your happiness or is preventing you from achieving your goals? For me, I know it's always been comparing myself to others or being afraid to ask for my needs, to get my needs met, because I feel like then you would abandon me. Or it was just like feeling like I'm not enough. The service BetterHelp is available for clients worldwide. BetterHelp will assess your needs and match you with your own licensed professional therapist, and you can start communicating in under 48 hours. You can log into your account anytime and send a message to your counselor. You'll get timely and thoughtful responses. Plus, you can schedule weekly video or phone sessions so you won't ever have to sit in an uncomfortable waiting room as with traditional therapy. Hear it from a review written by BetterHelp user CH after counseling with Dr. Carmen Velasquez for 2 weeks on issues concerning depression, intimacy-related issues, self-esteem, and ADHD. Quote, Dr. Velasquez is great. She checks in frequently over chat, had good availability on the app, and has a lot of tactical methods to try, which I appreciate. End quote. BetterHelp is committed to facilitating great therapeutic matches, so they make it easy and free to change counselors if needed. It's even more affordable than traditional offline counseling, and financial aid is available for those that need financial support. BetterHelp wants you to start living a happier life today. Visit BetterHelp.com/Leo. That's right. BetterHelp.com/Leo. Always wanted that little slash before my name. Now I have a slash. That's HELP. And you can join the over 1 million people taking charge of their mental health with the help of an experienced professional. In fact, so many people have been using BetterHelp that they are recruiting additional counselors in all 50 states. I also have a special offer for all BYKY listeners. You get 10% off your first month at BetterHelp.com/Leo. I just love saying the /Leo. Again, it's better, HELP/LEO. Dr. Stephanie Amos. All right. Doctor, well, now where's Amos from? First of all, like what's the origin story of Amos?
Oh, well, there's a really long origin story to Amos. My background is Jewish, and during the Second World War, my grandfather says that there were, this was the First World War. There were women who were losing their husbands at war, and they didn't have any way to pay for their kids. And so they would sell the name of their last name so that people could avoid the draft. And so my great-grandfather apparently bought the name off of someone, and the name was Ameis, and then at some point in time, it was cut down to Amos. That's the origin. So it's from Eastern Europe. Wow.
If this is the stuff I learned in history class, I would have sat up front. We're learning all the wrong things. That's a way more fascinating story because I have like a million other questions, but this podcast ain't about that. But that's a fascinating. I had no idea people were doing that. It's so crazy to me. Now, where are you at right now, Dr. Amos?
I'm at the Center for. Yeah.
Go ahead.
I'm in Toronto.
Mm-hmm.
Sorry, I'll give you a pause. I'm in Toronto. I'm at the Center for Addiction and Mental Health. In my office.
And what's your role there?
So I'm a child and youth psychiatrist here. I'm also a scientist. I do research mostly focused on young people with neurodevelopmental disorders, finding new treatments, using brain imaging to understand more about the brain. And I'm also the associate director of the Kundal Center for Child and Youth Depression. which is a center that's focused on improving prevention, screening, and treatment for child and youth depression in general.
Wow. So, what do we know about mental health in children and youth with the diagnosis in autism and spectrum disorder?
So, as a child and youth psychiatrist, I am mainly providing assessment and mental health care for school-age children, teens, and young adults with the diagnosis of autism spectrum disorder. And often, young people are coming to my office because they're struggling with significant symptoms of anxiety, depression, sometimes psychosis, suicidality, attention deficit hyperactivity disorder, and those conditions, what we call co-occurring mental health conditions, because they contribute to impairment and distress over and above the diagnosis of autism spectrum disorder, are real problems for young people.
Now, is there a protocol or a list of questions that you go through when they come in with these symptoms or signs of certain different disorders?
So that's a really great question. And what we are starting to learn from research is that there are increased rates of a number of different diagnoses, the ones that I've mentioned in young people with autism spectrum disorder. But from the research, we also know that the rates differ and vary significantly from study to study. And that's probably because we're not exactly sure how to ask questions to figure out if somebody has a diagnosis over and above the autism spectrum disorder diagnosis. We recently completed a study that was led by our team and by my colleague, Dr. Meng-Xuan Lai, and we looked at almost 100 studies that report rates of different mental health diagnoses in autism. Again, attention deficit hyperactivity disorder, anxiety disorders, depression, schizophrenia spectrum disorders. And we found that the rates are increased overall across the studies when we pooled the data, but they vary from study to study. The key message of that paper is that individuals with ASD experience high rates of co-occurring disorders and they need mental health support. But exactly how to ask those questions, we really need to have those discussions. So what we do in our clinical care is we do a very careful mental health screen. We ask about all of the symptoms and disorders that tend to occur more commonly in individuals with autism spectrum disorder for everybody who's coming in the door. So we ask about anxiety, we ask about depression, we always ask about safety and suicidality, because we also are starting to learn that suicide and suicidality is a big problem in young people with autism spectrum disorder.
So when they're coming in and they're saying that they want to end their life or they don't want to be here anymore, what's the common thread amongst them in terms of, do they feel like a burden? Is it pain? Is it the isolation? What are we finding?
Yeah, so I can say from the young people that I see in my clinic, oftentimes it's associated with depression. So they have the symptoms present that would warrant an additional diagnosis of depression, and the suicidality comes secondary to the depression, or sometimes it comes secondary to distress from anxiety. Oftentimes, social isolation and bullying has a major contribution to the way that they're feeling. They don't feel that they have people that understand them, that they can reach out to. Sometimes it's really difficult to talk about how they're feeling and express themselves. So some of the studies are showing that depression is a big risk factor for suicidality. Some studies show that ASD itself is a risk factor for suicidality, even when you control for depression, and things like social isolation and bullying contribute.
Yeah, I mean, I would imagine that part of what's contributing to the depression also is socioeconomic status. If parents can't afford to get their kids the help that they want, that I would assume that would contribute to the depression and the feeling of isolation. Have you found like a socioeconomic difference between people who have ASD versus those who don't? Well, let me rephrase that question. Have you found I'm going to edit that out. Have you found a socioeconomic difference between people with ASD?
In general, that
right.
people with ASD have lower socioeconomic status? No, it ranges.
Well, I guess what I'm asking is in terms of how they're able to cope, because I would just imagine if you are at the poverty level, and if you're a parent at the poverty level and your kid has ASD, the resources you might be able to have access to may be more challenging than someone who's at the upper end of the socioeconomic status, and so the kid may feel less isolated, or maybe even more isolated with the more money that they have. I don't know, but have you found a difference in how kids are able to cope based on socioeconomic status?
Well, I can say that definitely the more resources parents have, the more access they have to supports. Even in Canada, where we have national healthcare coverage, we have resources for individuals with autism spectrum disorder. Definitely, the more resources your families have, the more access you get, and definitely that can help. From a research perspective, what I can tell you is some research that's coming out of a longitudinal study that I have been collaborating with. It's led by Dr. Peters at Murray, called the Pathway Study, and they followed young people who have a diagnosis of autism from the age of 2 to 4 all the way up to their teen years. And in looking at predictors of outcome, predictors of anxiety, definitely economic status, family income, family stress contribute. So the more of that's going on, the more significant the negative outcome is in terms of mental health.
And, and I should have asked you this question at the top. Can we describe the signs and symptoms of ASD, autism spectrum disorder, for the listeners out there who may not know?
For sure. That's a great question, a great place to start. So the way that we diagnose autism spectrum disorder is based on two broad categories of symptoms, one being some social communication impairment. And under that category is problems with social reciprocity. So that's back and forth, just being able to share in a back and forth reciprocal way information in a social setting or social interactions. Also under that social communication category is nonverbal communication. So people with autism, they have difficulty with making eye contact. They have difficulty with facial expressions. And they have difficulty even with the tone of their voice and gesturing. So sometimes they may look very withdrawn or disinterested, but that's part of the autism spectrum disorder, and they may actually be very interested, but the way that they communicate that is different. Also under that broad category is relationships. So people with autism often have difficulty initiating and maintaining relationships with peers. So you have to have all of those things that I just mentioned in order to have an autism spectrum disorder diagnosis. Problems with social interactions with respect to reciprocity, nonverbal communication, and initiating and maintaining friendships. And then you also have to have what we call repetitive, inflexible behaviors. So these are sometimes really focused interests. So some of the young people that I see with autism, they'll have these interests that really are what they want to focus on. And they can be very, very narrow in terms of an interest in a very specific topic, but they know everything about that topic. There are sensory sensitivities under that category. So sometimes it's hyper or hyposensitivity. And some of those sensory difficulties can make it really distressing to be in everyday settings like school or the gym where there's a lot of echoes, or when there's an assembly and there's speaking on the microphone and there's a lot of background noise. So you have to have the social communication impairment, and you have to have the inflexible, restricted behaviors, interests, and activities. And you also have to have impairment. So those difficulties have to cause impairment in settings like school, family life, social settings. So that's the way that we diagnose autism spectrum disorder, based on the presence of social communication impairment and those restricted repetitive behaviors, interests, and activities.
When you brought up the light and the noise, and like they have challenges they have challenges dealing with overstimulation or sensory overload externally. And it brought to mind people who struggle with PTSD, and that light and noise, it can sometimes throw them off. It could cause a flashback. Are similar areas in the brain affected? And I know PTSD is not your specialty, but I'm just thinking of the question as you say that. Is it a similar area of the brain that's affected? Do you know that, or would you have any theories on that?
That's also a great question. So we don't know that much about rates of PTSD in autism. And I know that's not your question. Just there's not enough research out there. Anecdotally, and something that I didn't describe in the aspects that contribute to the condition, is that people with autism have kind of a sticky brain. They tend to like routine. They like things to be the same. And sometimes when they're exposed to things like bullying, they can get really stuck on those kinds of negative experiences. And it's really hard for them to shift off those thoughts. And sometimes that can contribute to more anxiety, and sometimes it can contribute to PTSD in autism spectrum disorder, because those bullying experiences are so salient and really take over somebody's thinking pattern. In terms of brain regions that are similarly implicated in ASD and PTSD, so you're right. PTSD is not my area of expertise, but the amygdala, which is a subcortical region in the bottom of the brain, is really important for things like fear detection. And that region tends to be implicated in PTSD. It's not the only region. That region also has received a lot of attention in autism spectrum disorder. But one of the things that we're learning from brain imaging is that there's not one region that explains any particular symptom. The brain is so complex, and we're only just at the verge of understanding some of that complexity. And we also know that people with autism, their brains tend to be more variable than other people. So if you look at the brains of individuals with autism, and you look at the brains of individuals who we would call typically developing, who don't have an autism spectrum disorder or another condition, their brains are more different from even each other, as well as the individuals who don't have autism spectrum disorder. And it tells us that there's a lot of variability there, and there's a lot of complexity about the different regions of the brain that are probably implicated. So that kind of went around that question very broadly, but I hope it answered it to some extent. I think there's some overlap, and there's some people that may look more similar at the brain level, even if they have different diagnoses. So an example of that is recently we published a study with the Province of Ontario Neurodevelopmental Disorders Network data set. It's an Ontario-wide initiative that recruits kids with different diagnoses, autism spectrum disorder, obsessive compulsive disorder, attention deficit hyperactivity disorder. And from that study, we have brain images and we have behavioral data. And we've looked at the brain images, and there's a lot of overlap. So individuals with autism, ADHD, and OCD, there are some subtle alterations that you see at the group level that are present across those conditions. And we also see that some of the wiring that we looked at in that study associates with everyday impairment. So the more impairment you have, the more your wiring looks a little bit different, but it doesn't really matter if you have an autism diagnosis, OCD, or ADHD. And so we're starting to understand in general that we don't have these discrete patterns that fit with one disorder versus another. It's more complex than that.
And I mean, that's why you also often hear people refer to it as being on the spectrum, because there's such a wide variety of, I was listening to a podcast of someone who was diagnosed with autism spectrum disorder. And, the school thought he wouldn't make it as a kid, and he was bullied and made fun of. But he went on to find his niche in making guitars, because he didn't have to socialize. It goes back to what you were saying. He wasn't good with social interaction, but he was very good at hyper-focusing, and he was able to hyper-focus on making guitars. So it's interesting because, growing up, autism spectrum disorder was just seen as a handicap, but in some ways, for some people, it can be a superpower, because a lot of people don't have the ability to hyper focus on anything. They're kind of scattered, and I wonder if maybe schizophrenia is the other end of autism spectrum disorder. I'm just talking out loud here, but what are did you want to comment on that?
Sure. Yeah. First of all, that's a great story that you heard on the podcast, and for sure, some of the satisfaction I get from my work has a lot to do with how amazing some of the young people with autism spectrum disorder that I see in my clinic are. They know things that I would never know about. They're experts at things that I learn about from them. And that hyper focus can definitely be a huge strength and can be the thing that helps them to move forward and find their way in the world and what they want to do. The point about schizophrenia spectrum disorder is also really interesting. We're starting to do more research on the overlap between autism spectrum disorder and schizophrenia spectrum disorder. One of the studies that we're working on right now is a large study that is in collaboration with an even larger study in schizophrenia, where we're looking at what are the regions and the brain patterns that are associated with social dysfunction in individuals with autism, and are they similar in individuals with schizophrenia spectrum disorder. In studies that look at people that have either diagnosis, there's a lot of similarities, meaning that the social deficits, the difficulty with decoding faces or figuring out social cues, subtleties in social interactions, they're not that different. And when you look at people of the same age, they don't really separate out that much. So I'm not sure if it's the opposite. Autism is the opposite of schizophrenia or opposite ends of the same spectrum, but there's a lot of overlap, and we need more research to figure that out.
Earlier, when you talked about risk factors, socioeconomic status, stress, family, are there other risk factors that aren't usually talked about in terms of what can cause the let me rephrase the question. Let me just rephrase it from the beginning. What are the risk factors that may contribute to increased mental health challenges in young people with autism spectrum disorder?
So the risk factors that we're starting to learn about are that, some of the things that put you at increased risk for different mental health challenges as you develop in the general population are the same in autism. So as you get older, things like depression, schizophrenia, spectrum disorder, bipolar disorder tend to become more common. And if you're a female, you might have more of a risk for depression. And that's the same as in the general population. Depression starts to become more of an issue in teens. The onset of a disorder like schizophrenia, spectrum disorder tends to be in the late teens, early adulthood. So there's overlap there. Other risk factors that we're starting to understand. So the same genes that put someone at risk for ASD may contribute to other disorders as well, like attention deficit hyperactivity disorder, obsessive compulsive disorder. So it may be that those genes put you at risk, not just for autism, but also to develop the co-occurring mental health conditions that I talked about. Some of the other things that we're learning is that executive functioning, so these are kind of thinking skills, like how well you shift from one topic to another, how well you hold on to information, how well you can inhibit responses. Those things can be a buffer or a risk factor for mental health conditions. So if you have better executive functioning skills in the general population, you tend to have lower rates of some mental health conditions. And we're starting to find that's an issue in people with autism spectrum disorder who have high rates of those executive functioning difficulties over and above the autism diagnosis. So those are some of the things that we are starting to learn about and know about. And definitely people with autism experience more social isolation. They experience more bullying and interpersonal distress. Sometimes they have lower physical activity and they have sleep-wake problems. And all of those things are general risk factors for other mental health conditions. So I think all of those things are areas that we need to learn more about to really fine-tune what puts you at risk for something versus another thing and at what time in your life.
Yeah. So it seems to me like autism spectrum disorder isn't maladaptive in itself. It's what else is it paired with? It seems like, if you have autism spectrum disorder, but you grow up in a loving family with resources and a school system that understands it, then there are ways that one can be integrated into I don't want to say general population like it's a jail, but so that, are they putting kids with autism spectrum disorder in separate classrooms, or how are teachers or schools handling this, and how could they improve what they're doing?
So those are all great points. There's some research that talks about the person-environment fit. So how well somebody fits within their environment, and that can be their family structure or whatever school setting or community setting that they're a part of. And if there's a poorer fit because, let's say you're somebody who has a really hard time with sensory stuff, with noises, and you happen to be part of a big family that's really noisy, that can make life a lot harder for you. Versus if you're somebody who has that difficulty and you're part of a small, quiet family, sometimes it can fit better in that environment and have less distress. So definitely those environmental factors, those family factors can have a huge impact on how someone does over time. Like we talked about before, autism spectrum is such a big spectrum, and there are so many variations in terms of how the diagnosis presents itself. And so what I say in general is not necessarily the same for every person because it can be so different. So sometimes there are genetic and biological factors that can contribute to these conditions or to dysfunction. And it's not about the environment necessarily. And the autism itself can cause a lot of difficulty and distress. But definitely if the environments around us are more flexible, are more understanding, and more supportive, that can improve things hugely for individuals with autism.
And what are some of the interventions that can help? From in terms of what can parents do, what can schools do, what can the community do? Like, how do we help people with autism spectrum disorder at these varying levels?
So, understanding, reducing stigma, having compassionate environments, really thinking about the individual and how their particular interests and challenges affect them in their everyday. Those kinds of things I think can be hugely important. So, just having me on your show, other anti-stigma campaigns, raising awareness about mental health and autism, those things will for sure make a huge difference over time by changing the way that we think and making our environments more inclusive. I think that's a huge thing that we can all do. We need resources in the schools so that teachers and parents can communicate, so that we can find varying environments for different kids that are of benefit. So your question about schools, sometimes there are separate classrooms, sometimes there are integrated classrooms. It really depends on the school, and that's true for Canada, it's true for the US. There's a lot of variability from school to school, from district to district in terms of the resources. So we really need a flexible set of options and a lot of resources to help people and to really make the environment more comfortable at the individual level and think about what every individual might need.
I read somewhere that in terms of schizophrenia, and once again, I understand that that's not your specific area of expertise, that how much, like you said, routine is important, exercise, but also nutrition, because like there are certain foods have a chemical reaction with our body and can trigger certain things and moods and, the highs and lows, especially with sugar. Is there a nutritional implication for people with autism spectrum disorder?
There's different research that's out there that has shown that sometimes varying diets and varying certain intake of certain foods can be helpful. There's not a hard and fast research base to suggest that there's certain things that all people with autism spectrum disorder should avoid in terms of foods. I think the broader key message is that eating regularly and having good nutritional intake can help in a lot of downstream effects. It can help to make sure that you can focus at school. It can help to make sure that you don't have those hunger lows that really can affect emotional regulation. So sometimes kids at school won't eat, and that might lead them to be more irritable, and that can cause huge problems with dysregulation and even aggression at school. So thinking about food, thinking about intake, definitely narrowed interest for food is a big issue for autism spectrum disorder. I've had stories from parents where they have to find really specific things in order to make sure that their kids will eat. So certain dip from a certain restaurant, or even containers from a certain restaurant, to make sure all their food is in that container so that they can get their kids to eat. So it's a constant battle amongst parents and kids.
When someone is suicidal, we tend to ask, do you have a plan? Where do you hurt? Do you have access? Is there a different protocol for someone with autism spectrum disorder? that we would click through for some if they were presenting as suicidal?
Well, there's sometimes things that we need to decode in individuals with autism. So verbal communication can be impaired in people with autism, where they cannot communicate at all or can't communicate as well. And so sometimes parents and families will decode their kids' routines and behaviors and see, are they at their normal? Are they at their baseline? And kind of knowing that normal and knowing that baseline is pretty key. And there's some really nice resources out there. There's a group in the UK that put out this toolkit called Know Your Normal to understand what those routines are and what that baseline is. So what time does somebody fall asleep each day? How much time do they spend on their projects? Do they tend to go to school regularly? And sometimes figuring out how somebody is doing is seeing whether the things that they often do that show that they're at their baseline are still there. Because communication can be really hard in terms of talking about when something shifts. And then the safety screening stuff that we go through is very similar as in people without this diagnosis. Are they contemplating, thinking about suicide? As you said, do they have a plan? Do they have the means? Have they tried something before? Are they engaging in self-injury in some other ways that's related to suicidality? So really figuring out, how much are they thinking about it? How much of a risk is it right now? And going from there in terms of offering care.
You know, I love that idea of know your normal, because a lot of us don't know our normal. It's, you know, by the time we realize we're off track or off our routine, it's hard to stop that momentum of the downward spiral. And if we had a better awareness of what our normal was, what time do we usually wake up, eat breakfast, and what works for us, that we could prevent or at least be able to easier manage a lot of downward spirals that we go through. What got you into this field of study?
Well, I started out as a child and youth psychiatrist, and I went and did my master's degree in neuroscience, and I got really interested in brain imaging and really interested in social circuits and how the brain processes social information. And that led me to my interest in autism spectrum disorder and my focus in that field. And then really the work that I've done in mental health and the kinds of things that come through my door when I'm doing my clinical work, depression, suicidality, those are key issues and key areas that have a huge impact for functioning for people. And they really get in the way of making good transitions. So being able to go from high school and go into whatever comes next and living up to your academic and your cognitive and everyday potential. So really trying to find new interventions and ways to help people. Those are the things that have kind of led me along the way.
I love that. And were your parents in this field at all, or what were their occupation?
My dad's a physician, not a psychiatrist. He's a physiatrist, a doctor of physical medicine, and my mom is a physiotherapist. So definitely the conversations about helping people and providing care had a lot to do with me going into medicine and psychiatry.
Beautiful. And I want to go back just a little bit. When we're talking about know your normal, I would imagine the importance of journaling has to be so great, whether it's the parents taking notes or the child themselves taking notes. But in terms of knowing what your normal is, I, for myself, have to journal every day to remind myself of what works for me and what doesn't work, what's effective, what's not effective in terms of breakfast, waking up, exercise. Should I work out in the morning? Should I work out at night? It really can be a lifelong process that sometimes changes with the seasons. Have you found how seasons can affect what people with autism spectrum disorder are showing up with or their moods?
That's also a great question. So, what we know is it tends to also come from the non-autistic field. So, usually around summertime, when school's out, kids tend to have less stress, less anxiety. They're coming to the emergency room less than during the school year. And anecdotally, although I haven't looked at this in my research, and I really haven't studied this so much and to see what's out there, the start of school, any time around breaks, and the end of school are big times when distress kind of bubbles, and kids can definitely go through periods of more dysregulation where they have more anxiety about going to school. They're having more difficulty regulating their sleep, their worry, etc. And that probably in autism has a lot to do with the difficulty with transition. So people with autism, they tend to like their routines. They tend to like things to be a certain way and get stuck to those things. And those are aspects of life that really help them to maybe determine to feel certain and secure. And then when those things change, and even seasonal changes, where you have to shift from t-shirts to long sleeves, or you have to start wearing boots, or leave your sandals at the door. So sometimes those things can be a big issue because you're having to transition and the feel of those things is different. So definitely the school year for the young people that I see and the change in seasons have something to do with distress. But it tends to have sort of practical mechanisms with respect to the transitions in what you're wearing and what you're doing.
So what for the parents out there who see their kids under distress and, the school year is about to start and all the anxiety? I mean, even if you don't have autism spectrum disorder, the average person struggles with transitions, whether it's going to college, leaving college, going from one job to the next, getting married, getting a divorce. Transitions are a challenge for so many people. So how are we coaching parents or schools and to be able to address the distress in their kids who have autism spectrum disorder?
So some of the things that tend to help are just prep and anticipation. That's not specific to autism. That's for all of us, but it tends to help a lot for young people with autism. So go to the school before the first day, walk there, get into the routine beforehand so that you minimize all the change at once and know who the teachers are. Make sure the teachers know what makes kids feel comfortable. Give them that flexibility to have a little bit of space. So all of those kinds of anticipatory things to help with mental preparation can help a lot. Some practical things, you can have a storybook where you have a picture of the school and you have a picture of the teachers and you have a picture of what the routine is going to be like. I'm going to go to bed at this time. I'm going to wake up at this time. We're going to walk to school that day. You have all of those things that are prepped, and that anticipation tends to reduce distress. It doesn't take it away completely, but it tends to help with those transitions.
Wow. I just not moved, but I'm kind of staying down here in San Diego. I live in Los Angeles, and it has been a bit distressing for me because I don't know San Diego. I don't know how to get around. I need the GPS for directions most of the time, and I don't know where the gyms are, the coffee shops. And you're so right. If I had just taken the time to just drive around San Diego, kind of get to know it, look at a map, kind of get an overall understanding of the layout of San Diego and where things are, it would have greatly reduced my stressing and going to businesses and gyms and just kind of get to know so this is, like you said, is great advice for anybody who's transitioning is, to really take the time to to learn your surroundings and your new environment versus just hoping you'll figure it out day to day. It doesn't really help. In terms of what you see the future of interventions for people with autism spectrum disorder, what do we see in the future? How are we gonna? What's the progress being made there?
Thanks for that question. We do have interventions that we know can be effective, but we desperately need more research and more effective interventions. So right now, we often borrow from the literature, the research out there that tells us what evidence-based interventions are for anxiety or depression or ADHD in children who don't have autism spectrum disorder. There have been enough studies out there that we know that the treatments for ADHD, they work in people with autism spectrum disorder who also have ADHD. Something like cognitive behavioral therapy for individuals that can engage in that form of therapy, which is not always possible, but that treatment can help for people with anxiety and autism spectrum disorder. We have very little information about best treatments for depression. We even have very little out there to know what to do when our frontline treatments fail for people who don't have autism, who are children and youth. So depression is a huge problem in teens. And in my work as the Associate Director of the Kundal Center for Child and Youth Depression at CAMH, I know that 60% of young people who have depression who don't have autism will respond to the treatments that we have. And the relapse rate is about half of those people that do respond. So they get depression again. So even though we don't have enough research to suggest that the treatments that we use in children and teens who don't have autism, we don't have enough research to show that the same treatments will work in ASD. We do have some anecdotal experience that kids with ASD can benefit from cognitive behavioral therapy, as would be recommended in kids without ASD. And we know anecdotally, although we need research studies that show that the treatments that we have, like the selective serotonin reuptake inhibitors, medications, antidepressants, they probably can help for individuals with ASD. So those are still the recommended first treatments, although we know we need more research to figure out how they help in people with ASD. What becomes more difficult is what happens when those things don't work. And often the times, working in a tertiary care center where young people have usually already gone to their family doctor and they're coming to a psychiatrist because those first line treatments didn't work very well, that's where we don't know exactly what to do. And we need more research there. So one of the studies that we're embarking on now, our team, is to look at a treatment called repetitive transcranial magnetic stimulation, brain stimulation, where you use a magnet to activate neurons just below the surface of the brain. And for people who have treatment-resistant depression, who are adults, about half of individuals will respond. Sorry, are you still there?
I am, yes.
Oh, okay. Something just happened, I think, maybe. What we're going to do is we're going to look at whether that brain stimulation treatment that we know helps for people who have treatment-resistant depression, that where psychotherapy, and medications didn't work, we're looking at whether that will work in young people who have autism and depression. So we need more studies. We need more studies, and we need larger studies, and we need them fast so that we can have the research findings to figure out what the best treatments are. And it's also tricky because we know from the general literature, it takes about 17 years from the time that we have a research finding for it to make it into general clinical care. It takes way too long. And so we really need to do this research. And that's part of why campaigns like the Not Suicide, Not Today campaign that CAMH is embarking on is so important, because it can raise funds and raise awareness, and that awareness really helps to jumpstart research and reduce stigma, so people are interested in engaging in research.
Yeah, what's the percentage of I know you're in Canada, the Canadian population that have autism spectrum disorder, and what are the worldwide rates?
The worldwide rate is pretty similar across countries, and it's about 1% of the population have this diagnosis.
And where can people donate to in order to help or learn more? What would be a good resource for people to go to?
There are lots of different resources out there. Autism Speaks is one of them that it has a network across North America that connects doctors and different healthcare providers and families with up-to-date information about care and resources for people with autism spectrum disorder.
There's a Netflix documentary I just watched, The Speedcubers. Have you seen this?
No, I haven't.
It's remarkable. It's about two kids who, excuse me, are competing to be the top Rubik's Cube solver. Like these are kids who solve the Rubik's Cube in like 3.5 seconds, 2.5 seconds. You know, like it's insane the number, how quickly they can. Are remarkable, extraordinary, how quickly they can do this. And the two main characters that they focus on, one is, I forget the one kid's name, but the other kid has autism spectrum, has autism. And he is 19, but he is kind of emotionally more like 9 or 10. So we kind of see him grow up and function and be hyper-focused on this one particular thing and learning how to interact socially with other Speedcubers throughout this episode. It's only 40 minutes long on Netflix, but it goes back to what you were saying of like he was able to hyper-focus, and early on, if he lost, he would get upset, but he learned through time how to manage losses and manage his emotions. Of course, he's still working on it, but we got to see him get better at doing that and see how the family interacts with him so that he can thrive in this world of Speedcubers. I don't want to give the ending away, but I was riveted. Me and my girlfriend were like, what? We were just glued to the television. So I would assume that programs or documentaries or docuseries like this, bringing attention to it, can help with funding as we as the public learn more about autism spectrum disorder and are more understanding of what they're going through.
Yeah, absolutely. I will watch that documentary. In my clinical practice, I often will tell parents who might be parents of young children, but they're coming to me with concerns about what will things look like when my child is a young adult? How will they navigate the world? How will they do without me when I'm not around? And some of the things we talk about is that where things are right now is not where things will be later. And we can grow and shift and change in so many different ways. And that's really the goal. Sorry, go ahead.
No, you said that's really the goal. Can you continue?
Yeah, so many of the young people that I see, and this also will vary depending on a person's particular situation and sometimes depending on their verbal ability or their intellectual ability. But we can all learn skills. And I often say that, only a very small minority of people will become or are virtuoso piano players, will become masters. But if we practice and we dedicate the time, most of us can learn to play piano. And it's the same kind of thing. So over time, a lot of the young people that I see, they will learn how to decode social interactions or figure out how to pass. And they'll, in a cognitive way, sometimes learn how to get a by in social interactions. And sometimes that can cause a lot of stress because they're always sort of on when they're outside of the house, and the only time that they can really relax is when they're on their own. But you can learn. And just like that character, or the person that the documentary was about, things change over time. And so it's really important to hold on and keep providing support and keep working towards developing those skills.
I love that. Like maybe 10 years ago, I ran into Neil Strauss, who's an author, and he was running a mastermind group. Weekend, it was a 2-day group, and it was maybe about 100 guys. They paid $10,000 each to learn how to interact with people socially. These were guys who were like CEOs, entrepreneurs, they made millions of dollars. But because they were so hyper-focused on their work and their job, their social skills atrophied. And so they were taking a 2-day seminar from this guy to learn how to interact with people and socialize and, like you said, decode. So I'd be interested to see how this whole quarantine thing affects people's ability to socially interact. And I only say that because if there are listeners out there who do have autism spectrum disorder, or somebody, to know that you're not alone, and that a lot of people paying $10,000 to learn how to socially interact. It's awkward for a lot of people. I understand the situation is different, but it's just my way of saying that we all have things in common to varying degrees, and so hopefully that conversation can more reduce the stigma of it.
Absolutely.
Is there?
Yeah.
Go ahead.
No, it's just that we all are on a spectrum of ability or less ability with our social functioning. So some of us are really good at math, but we're not that great at holding a conversation. And so, I think that again, some of the reason why I love my work so much is that I can relate that there are things that I do well and other things I really don't do well at, and I have to practice much more, and that's all of us.
Is there anything, Dr. Amos, that we haven't discussed in terms of autism spectrum disorder, the treatments, the signs, the future implications, anything?
No, I think we covered a lot, and it's been very enjoyable to talk with you about this topic. And I think the thing that I really hope will resonate is that mental health is a huge aspect of care and support needs for young people with autism spectrum disorder, for people with autism spectrum disorder across the lifespan. That suicidal thinking and suicidality is a huge issue of importance, and seems to be increased in this population based on the research that we have. And we need more in this area. We need more work, and we need people who are providing care for individuals with autism spectrum disorder, autistic people, to think about those kinds of safety concerns and ask about it. I think those are the big things that I want to make sure that people know in listening to the podcast.
And I know you mentioned resources earlier for people to check out, like Autism Speaks. Are there one or two other resources, especially for family members, that they can reach out to? Or is there, even a CAMH website? Where can families find additional resources?
So some additional resources through the CAMH website can be found through the the part of the CAMH website that goes through the Kundal Center. The Kundal Center for Child and Youth Depression have lots of good resources in general for depression, suicidality, for people without autism. And we're developing new resources for people with autism on that website. There is a lovely website that I was talking about before called Know Your Normal. And if you just Google Know Your Normal, you get that toolkit, lots of information about mental health that I think will help a lot of people in terms of thinking about their baselines and when things are different. And that's helpful for families too, because it can help them to identify when they need to be worried and when things are going okay too.
Dr. Amos, the last question, I ask this of all my guests, because I always imagine there's one person listening in who may be on the precipice of ending their life. Before you kill yourself, what would you say to them?
I would say that please hold on and please reach out. That talking or texting or interacting with somebody either within your community, your family, but also outside, using some of the supports that are available in Canada, the US, wherever you are, helplines, reach out, because talking to somebody and thinking about things and reflecting on what may change can be very helpful in seeing a different future. Please hold on. And the campaign that CAMH is launching is really about having discussions about reducing stigma, raising awareness, so that suicide is prevented, so that people choose not today, and that they'll go on to a tomorrow, and that we're working on it. We're working on making systems better and more aware, and we need research to reduce stigma and to figure out what the next steps are.
Dr. Amos, thank you so much. Thank you so much, listeners, for tuning in. Remember, this podcast is not a substitute for you going to get help, for you calling the 1-800-SUICIDE or 1-800-273-TALKS, or the other 20 other resources and numbers listed in all of the show notes. I know I have listeners in Canada and overseas. There are international phone numbers. They are listed in the show notes. There's someone out there who is willing and ready to listen to you, to help you, to ally with you, and to sit with you. Just to be with you, just to sit with you, and maybe say nothing, but just to let you feel a little less alone in the world. As you heard from this episode, we have a lot of people working on interventions to help you, to help us, to help the world. Know that someone at all times is fighting for your life. But you have to make that first step and reach out and hold on. Thank you so much for tuning in. You can always go to thrivewithleo.com for one-on-one coaching with yours truly. Let's get to tomorrow together. Thank you so much, Dr. Amos.
Thank you so much. It was a pleasure talking to you.
Remember, today's episode was brought to you by BetterHelp. BetterHelp is not a crisis line and wants you to start living a happier life today. If there's something interfering with your happiness or preventing you from achieving your goals or feeling connected, go to betterhelp.com/Leo now. Enjoy your 10% off and start moving closer to happiness and thriving today.